Hi, this is Dr. Bender. I'm here with my new patient. He is 6'11", is that correct, Jared?
It is.
And how much do you weigh?
About 380.
380, 6'11", and people have asked me before, is it more difficult to adjust bigger patients? And the answer in this case is actually no. Jared is actually one of the easiest patients to adjust because he's relaxed when I adjust him. And the most difficult patients to adjust are typically lawyers and also accountants and nurses, especially those who have been working in the profession for a long time because of the tension that they carry in their muscles and in their spine. But Jared gets adjusted quite easily, and we've had some good results. Today's our third adjustment. Jared, what did you come in for?
Having numbness in my hand, little issues in my neck, and I was told that it was pinched nerves. So came to you to see what you could do to help out.
Okay, and we did have a little bit of pinching in the cervical spine. It was entrapping one of the nerves radiating down his arm, and those symptoms have decreased.
Okay, I've gotten a lot better, yes.
Okay, and that was only after 2 visits. So we're headed in the right direction. I suspect this is going to be another successful chiropractic case. So are you ready for a third adjustment?
I am.
All right, let's see what your spine
Let's do
says.
it.
Okay, Big J, I'm going to do an analysis of the thoracic spine here. The first layer of analysis is that of the muscle group. We're looking for 2 muscles. One is called the rotator muscle, the other one is called the multifidi. And is that tender right there?
Yes.
And so when we find one of these muscles that's activated or engaged, what the spine is telling me, or what the muscles are telling me, is that the muscle is trying to pull the spine to the left. And so when I put a thrust into the spine, I'm going to help that muscle out by pushing slightly to the left. And it kind of already moved there a little bit. And so when you push in the right place, you don't have to push hard because you're just trying to accomplish what the body is trying to accomplish on its own. So then I follow down the rest of the thoracic spine, looking for any more. We have one more rotator here in the thoracic lumbar transition. Is this tender here?
Yes.
Okay. Now the second layer of analysis is a mechanical layer, and what I'm going to do here is just basically check the spine for springiness or joint play and how much give or flexibility is in there. And so when I push into the spine, the ligaments and the muscles will all kind of react to that, and they will push back just a little bit. And that kind of play or springiness gives me an indication of whether or not the spine is stuck. And so the majority of segments that we adjust in chiropractic are the segments that are not moving properly, segments that are actually stuck in between the segments above it and below it. And so I can kind of just feel which segments are not moving like the ones above it and below it. And so like right here, which is where we found that rotator muscle, is telling me that this is not quite moving. That's springy, and this one there is kind of different. Does that feel different to you?
Yes, for sure.
Okay, so that's 2 hits out of 3 where the muscle is activated and engaged there, and the segment is not as springy as the one above it and below it. So that's a good indicator that that's going to be the first or second place that we're going to adjust. And then the third layer of analysis is a very superficial analysis where we just kind of run on top of the spine here 1 or 2 times, and I'm feeling for very slight differences in tone of the spine. Tone is a very subtle engagement of muscles, tendons, blood vessels, nerves. All of that has an accumulated or an amalgamation, a feeling of tone, and that'll give me a final indicator of where the main areas to adjust are. Okay, so let's do it. Okay, again, deep breath in and out. Good. And so it gave before I even pushed. And it was just a really good indication that that was the right place to push because there wasn't a whole lot of work involved. So now we're going to come down to this one here. This is the one we had 2 hits out of 3. The tone here is definitely increased on the left. And so let's just give this a nice little push here. Nice soft breath in through your nose and out through your mouth. Good. And just let it down here. Very deep. Okay, so this third one way down here in the transition area. This one's going to be a little bit tougher just because there are slightly larger muscles here in this area, so I'm going to push a little bit harder and a little bit faster, but the result will be the same. It'll be a nice gentle release into your spine. So good, let that breath out, and then take one more breath all the way in, far in as you can go, and out. On your side, this side face me. All right, so now we're going to adjust the lumbar spine here, right at L5. Take a deep breath in through your nose and out through your mouth. We're going to bring this down here. One more. Good. Laying back. Numbness?
No, no, I was cracking my fingers.
Okay. Take a deep breath in through your nose and out. Good. One more. Good. Laying back. Alright, pull this out just a little bit like this. Alright, Jared. We're going to get this little stretch here. Take a deep breath in and out. One more. Here it is, laying your back. Alright, so I'm going to do an adjustment on your shoulder here. Bend this elbow. I'm going to bring this up like this, and I'm going to reach around the front. Bring your chin to your chest and lean forward just a little bit. Let the shoulder relax here. That's good. Let this relax here. Just let your arm, shoulder down. There you go. Good. What size shoe do you wear?
17. Until I was 17, my shoe size was always a year older than me.
Mm-hmm.
You know, so when I was 10, I wore an 11. When I was 11, I wore a 12.
Where do you get them from? Do you have to order them online, or?
Well, I mean, I order, you know, shoes. If I want sneakers, I have to order from like East Bay.
Mm-hmm.
Shoes, I can order them from DXL, Big and Tall Man stuff.
Mm-hmm.
You know, suits and stuff I gotta get made.
Mm-hmm.
I'm from New York, so I just go home.
Bring your chin to your chest again. Lean forward just a little bit. Let this shoulder relax. Good. Okay, relax here. All right, so we're going to adjust the left side first here, down at the bottom and around at C5 and C6. We're going to bring it over to the side, just right here, and then give a little push like that, okay, Jay?
Yes, sir.
All right, little push, nice and gentle here.
Oh. All right.
Now one on the right side. We're going to bring this over here like this. Oh, there it goes, it's moving already. Mm-hmm. And a little push. Oof. All right, man, how's that feel?
Feel good.
Good.
Feel good, yeah.
All right, so I think that we're definitely on the right track. The rest of the tissues, as they're healing up and the inflammation will probably come and go, and depending on your activity. We'll do one more follow-up in 2 weeks just to make sure that everything is set where it needs to be.
Sounds good.
And then make sure I've done everything that I can do for you.
Sounds good. All right.
Thank you very
sir.
much. Yeah.
All right.